name is Nienke Schutte. I am heading the Innovation in Health Information Systems unit at Sciensano. Sciensano is the Belgian Public Health Institute, but also a research institute. And that is why we would like to leverage the EHDS. It was already mentioned this morning, EHDS as a tool that you can use to leverage, to improve health information systems, and by extension, the health of the citizens within that system. I should click. All right. So this is me. Of course, my body has been slightly changing now over the last couple of months, but this is me. I am working at a public health institute, and what do I do in this public health institute? I get in research questions. I do have research questions. I'm a researcher by training. We do get parliamentary questions in from our government. We also have to produce official statistics. So this is a bit in the nutshell what we do at Sciensano at a public health institute. For this, you need to mobilize data. And you need to do some data collection. And Mark was actually quite surprised that I wanted to remove EHR from the previous title that was there, because it's not only EHR data that we're using. We are a public health institute. The data that we collect or try to mobilize range from reimbursement data, hospital administrative data. We do the larger health surveys, for example, the interview survey, the health examination survey. So we also do biobanking. We collect also data for when it comes to genomics, to do public health genomics data, etc. And then also mobility data, environmental data about pollution, etc. This is all needed to address the first part, the research questions, the parliamentary questions, and the official statistics. Of course, we do data analysis. We are scientists, after all. We drink a lot of coffee. And there is some reporting needed. And then finally, of course, moving to the last part, we shouldn't forget this. We are a knowledge broker. We are a public health institute. We communicate. We do outreach activities, not only reaching, of course, policymakers when the questions come from, but also our fellow researchers, healthcare professionals, other health professionals, and of course, citizens and the patients should not be forgotten. So I would like to focus on a few of these topics, just to highlight how we can leverage the EHDS to make my work a bit easier. So let's first talk about data mobilization. And I just put here some quotes from great reports, actually, coming from the observatory, coming from one of the projects that we've been working on in a couple of years ago, and also from the OECD handbook for comparative education statistics. So they all mention the precondition for effective surveillance mechanisms, as we do at Sciensano, is the ability to collect timely, complete, regular, good quality information on a broad range of indicators, to create value for society as a whole, patients and citizens, the patients of tomorrow. We have to ensure high quality data and smooth access to this data. And even if data are accurate, it cannot be said that they're of good quality if they appear to be produced quite late, cannot be easily accessible, etc. What is the common denominator in all of these quotes? And we already mentioned it before, it is data quality. If you put garbage in, you get garbage out. And actually, this is true for the whole data journeys. We always talk about the user journey or a patient journey in a care system, but let us think a little bit about the data journey. It gets generated at the source. It should be of high quality there to actually improve the health or restore the health of a person. And of course, for reuse, this data needs to be of high quality to answer research questions, my parliamentary questions, and of course the official statistics I need to produce. But also if you feed it to train an AI algorithm, you need high quality data. Of course, everybody says you need big data, but actually you need better data. Very important. And then finally, the policymakers need to trust us as scientists that we deliver high quality information based on this high quality data. So data quality is very important in every step of this data journey. And what can we do in the EHDS? What is very nice in the European Health Data Space, there's an article, and it's article 78. I'm using the new numbering. Maybe if you've seen it on Friday last week, the new version of the European Health Data Space regulation came out. There are over 330 pages now with over 100 articles, but this is the article that you need to refer to when you talk about data quality. Data sets made available through health data access bodies may have a union data quality and utility label. So every data holder needs to provide this label. It is part of the metadata record. And we can leverage this to have better and high quality data in. Health data holders need to renew or check their metadata record every year. So it's also an incentive for them to improve the data quality of their data sets and improve valorization. So this might hopefully lead to better assessment of the reliability and suitability by a data user. I can assess the quality of a data set. It can increase the quality, this incentive mechanism, very important, valorization. But also the training of AI algorithms. We've heard it, AI everywhere. It's everywhere in health, in other data domains. We need high quality data to train our AI algorithms, especially when you want to find health indicators, do hypothesis-free testing, and provide some more information about what constitutes good health. And of course, finally, better research outcomes. We have a project, a Horizon-funded project, which is the Quantum project, in which we actually develop this European Health Data Space Data Quality label. And I really hope that we will have the first deliverables out sometime next year. All right, going back to me, back in this Public Health Institute, let's focus a little bit on outreach, knowledge translation. Also a very important part of the life cycle of research, which is sometimes overlooked and sometimes forgotten. And I'm very happy that the previous speaker already mentioned citizens on the slide, because it's a very important part of our stakeholders. So of course we have policymakers on all different levels, also very important in Belgium, also regional levels, very important here. Research networks, academic communities, but also the international players, especially here in Brussels, they're easily to reach, that's great. And of course, healthcare professionals, and then there's the general public, citizens, and then by extension also the patients. So maybe give a little bit of background. Why is this so important? And what do we actually already know about what citizens think about that we use their data for research, for parliamentary questions, and for official statistics? So a couple of years ago, well, not too long ago actually, colleagues of mine at Sciensano did a citizen consultation on the secondary use of health data, so the reuse of health data. They did an EU-wide consultation, and we got almost 6,000 suggestions coming in from citizens all over Europe with regards to the secondary use of their health data. And we've created this framework that contains recommendations spread over 3 domains. So you have the data relationship domain. So it's very important that you do good and transparent communication. There's a plurality of views. There are multiple stakeholders involved, which need to be acknowledged. Citizens want to be involved in every step of the data lifecycle. So continuous engagement is very important. And citizen-supported benefits. So citizens need to count on the fact that stakeholders respect their perspectives when doing their research. And have shared values with regards to this part. Of course, citizens want to have control over the data. Data doesn't need to be identifiable when it's reused for data. Transparency, technical safeguards, very important, all part of this power balance between the citizen and the person that are using this data. And finally, on the lower level, the governance and ethical values. Citizens really would like to see that the people that are using their data share the same values as they have. That is more important than putting into place technical safeguards in order to make sure that this is guaranteed. They need to have the idea that the same values are shared between the 2 of them. And of course, this would need a good governance network. So going back to the European Health Data Space, how can this help us reach this? Well, what is very nice that there are actually a lot of articles dedicated to citizens and the rights that they have with regards to their health data. So with regards to the primary use of health data, of course, they have access to know who access data themselves, authorize others, insert data, rectify data. There's the right to data portability, which is also already part of GDPR. To restrict access and also to opt out. If you do not want some data to be in your electronic health record, it should be possible to have an opt-out system there. And this might help to place citizens at the center of their healthcare. There is a very nice project currently ongoing. It's also an Horizon project, which is the ICSHA project, was already mentioned by my colleague, that is actually trying to bring this into practice, to create a button that features into health portals, into apps, that actually allows people to exercise these rights. This is an ongoing project. I think it's now a year, and there might be 2 years ongoing, so please keep an eye on this, because it might be very important when it comes to patient rights. Moving to secondary use of health data, because that's what we do a lot at the Public Health Institute. So there are several articles dedicated to patients' and citizens' rights. And it might not be always so clear that this is related to their rights. They have the right to opt out, of course. Data cannot be reused. Of course, there should be clear information about secondary use rights, conditions for data access, etc. It should be clearly communicated. Then, of course, there is purpose restrictions. You cannot use data for everything. There are restrictions currently already listed in the regulation. End users who are using the data are obliged to make their results public, so you know what happened with your data. And then finally, there are some legal and technical safeguards. One of the examples here is processing the data in a secure processing environment. So not download the data just to your computer, but have it in a secure standalone online environment where you can use or process the data, do analysis on the data. So this all pertains to citizens' rights when it comes to secondary use of health data. And we have another project ongoing that is a joint action TEDAS. It was already mentioned by Beatrice earlier, where we have a work package really dedicated to serving citizens, where we will talk about implementing the opt-out protocol. We will provide guidelines for member states how to do this. We will try to talk about setting up a citizen information point where people can go to find more information. And of course, we will clarify what are the data user studies regarding the research outcome. This means, what does a data user have to do to inform the patient or the citizen? Is just a peer-reviewed article in a scientific journal enough, or should we do more? This will all be clarified in this TEDAS joint action. So going back to my life in a research institute, and I wanted to dedicate some slides to coffee, because I have to say the coffee at Sciensano is not the best coffee in the world. Here it's much better, so that's why I was already here all morning. But of course, let's not do this. Let's focus on what the European health data space can do for each of these parts. Because actually, all of these separate parts, I've just highlighted two, but all of these, maybe except for the coffee, unfortunately, are affected by the European health data space regulation. So are member states ready? What should be the priorities now for member states? Because this is just the Public Health Institute that I'm working at, but this affects all the different countries. This regulation will be into force into February or March next year and will be in force in all member states. So in the previous edition of the Joint Action TEDAS, we did country assessments. Are countries ready for this? Well, we currently see that a lot of countries do have a strong health data landscape, but there are fragmented systems. Lack of digitalization, I don't think I have to mention it here. And of course, also a lack of this persistent unique identifier. So it makes it very difficult to link different data sources. There's also a lack of data quality and interoperability. International standards are there, but not always used the right way. My previous speaker already mentioned it. And national standards that sometimes are bottom-up developed, sometimes hinder this cross-border interoperability. There are challenges to access because there are different fees, there are the different delays. A researcher needs to wait a long time. There are legal and governance issues. This is actually a very important one. A lot of countries have very different interpretations of legislation, as for example, the GDPR, which makes it very difficult in different countries to get access to data because legislation differs. And this would also need to be addressed when creating a roadmap for the implementation of the European health data space. And of course, we would need resources to do all this. So these, and of course, the stakeholder views, it's European health data space is seen as beneficial for data sharing, but there are a lot of buts. So in general, we saw that in the country assessments that we did, the politicians, the regulators, and other stakeholders that we've interviewed are positive. However, a tailored roadmap for each country is needed. There's no one-size-fits-all roadmap for each country to implement, because you see very much differences in legislation, in technical implementation, and in organization. and then in resources. So how do we advance public health and how do we advance citizen impact using this European health data space as a tool? It can be a turning point. I really see this. It can really turn around how we work in Sciensano, how we work when it comes to doing research and innovation and policy making in Europe. It streamlines the use of data for specific purposes within health systems, and it can improve overall data equality using this as an incentive mechanism. It can provide citizens with more control over their data, and it has the potential to provide really data governance framework that is transparent, that includes accessibility and inclusive decision-making. And I think also the trust is here a very important part. Not only the politicians trusting us that we deliver high-quality results, but also the citizens that they trust that we use their data in a responsible way.